Hi there, and welcome to The Public's Health, the show that puts you, the public, back into public health. I'm Dr. Tony Iton, your host. Today we're going to be talking about a subject that is probably of great concern to you. It's certainly gotten a lot of media attention. Avian influenza, or bird flu, has killed people in various countries around the world, and it has certainly infected a lot of birds, some of which are migratory birds, and the expectation is that eventually it'll come to the United States. We're going to be talking about this subject from a slightly different perspective. You have a daily routine, the things that you need to do to continue your daily lives. You need to go to work. You need to get food. You need to use transportation. Your children need to go to school. And finally, many of us need to get health care. We're going to be talking about this subject from those perspectives. How do you maintain your daily routine? During a circulating pandemic, when the virus is in our community, we're going to have concerns about coming into contact with strangers, people at the grocery store, people at the pharmacy, at the post office, at a variety of different places where we might feel that we could be exposed to the virus. This show is going to talk to you about some simple precautions that you can take and give you a little bit of knowledge about how you can avoid becoming infected by just practicing simple respiratory hygiene, hand washing, the kinds of things that your grandmother always taught you. We're going to talk to some experts, and we're going to see some different settings in which precautions are being taken and planning is being done to try to minimize the risk of exposure in these settings. We all need to do these things. We need life to go on during a pandemic. We hope that this information will help you, help us, keep as many people healthy and safe throughout this pandemic. Thank you. One of the things that we're all going to be concerned about during a pandemic is how do we access health care? And specifically for many of us in our communities, elderly populations, people with disabilities, they have a need for regular pharmaceuticals or medicines. We're joined now by Ed Clarke, an expert in pharmacy and the proprietor of Webster Pharmacy in Alameda for 35 years. Welcome, Ed.
Thank you, Tony. Nice to be here.
Ed, tell us a little bit about the kind of clientele you serve at Webster Pharmacy.
Well, we're a typical community pharmacy in an area that's blessed with a variety of people from backgrounds from all over the world, Asian, Bosnia, whatever, as well as people that have grown up in Alameda and lived there all their lives. The majority of our patients, of course, are older people. Mm-hmm. More susceptible to disease and also more susceptible to things like the pandemic flu. Mm-hmm. So we try and counsel our patients through a special section we have in our pharmacy that provides privacy and confidentiality. Mm-hmm. When discussing their personal needs. We try and put together plans of action for them in case of a community disaster. We try and recommend that people on chronic medications in particular keep on hand an extra, at least a month's supply of their chronic medications if possible.
So in some ways you really know your patients as well, or in some cases probably better than a lot of doctors do.
That's true, Tony. As a community pharmacy, we get to know every generation of a family, sometimes 3 or 4 generations. So we're well knowledgeable about a family and their particular problems. And we also welcome new people in the community, and we have a special section of the pharmacy where we can counsel people on how best to take their medications. We also are concerned that sick and elderly people in particular can't always get to the drugstore. Mm-hmm. So when that happens, we have a free home delivery service that actually we're running 10 to 12 hours a day, providing medication to those folks who just can't get out to go to the pharmacy.
Well, that's great. So if I can't get out of the house, I can call up Ed at the pharmacy or your assistant and say, can you deliver my prescription?
Absolutely. Community pharmacy, I think, is based on the patient's well-being as much as anything. We're there to serve the people, and I think they do a good job of it. On the other hand, there's other forms of prescription delivery that work well also. Sometimes not as personal, but they seem to end up with pretty good results. Things like mail order pharmacy, some of which is the only thing available to people living in rural areas or areas that don't have community pharmacies. Another innovation that's becoming popular in many urban communities especially is the drive-through pharmacy, where you can go to the drive-through window, pick up your prescription if you're ill or concerned about being infected by other people that might be waiting for their prescription, pick it up at the drive-in, and you can be on your way without that kind of exposure. So there's a number of ways that both community and chain store pharmacies, as well as mail order, can provide those services to folks.
Well, that's really great advice. Now, let me ask you something else, because you're our expert. If I'm thinking now, I just need to have a little extra medicine on hand in case anything happens. I need to stockpile medicine. But my insurance company's given me the runaround about, I can only get 30-day supply. What kind of advice would you give to people about making sure that they have a little bit of extra medicine for emergencies?
Well, a lot of the insurance companies, particularly under the new Medicare Part D plan, limit the patient's days supply to 30 days. And this can be a problem, particularly if you need to set something aside, which I really recommend. I recommend that people keep an extra month's supply on hand, just for these types of events if there is a disaster or something else.
So your pharmacists, they're your friends in this situation, and you should consult them. They have very good advice, very good information. Thank you, Ed Clarke of Webster Pharmacy. We appreciate you coming on the show. And now we're going to move to how do you access health care services during a pandemic.
And now, another episode of Pandemic Detective. Today's episode finds the investigator on the Oakland waterfront.
The suspect in this case is Vi, the virus. Let me dish out the facts. She's small and very dangerous. She travels around the world now and then. She likes birds. She might learn to like you. I'm watching for her. The health department's watching. If Vi the virus shows her ugly mug, we'll be ready. So cover your cough, wash your hands, and keep your eye on Vi the virus.
Brought to you by the Alameda County Public Health Department.
So we've heard about pharmacies and how you maintain your medication supply in a pandemic. Now we're going to talk about your routine medical care. And we're joined now by Leslie Greenwood, who's the immunization coordinator for Alameda County. And she runs immunization clinics all throughout the county for thousands of people. Thanks for joining us, Leslie.
Thank you.
So how many people do you actually immunize every year with our
I would
influenza?
say about 25,000.
25,000 people all around the county.
Mm-hmm.
Tell us a little bit about what goes into planning a large-scale immunization campaign.
Well, we fortunately have contacts with many of the people, all of the agencies that we work for in the county, and we get mailings together and send them out, talking about the prioritization for the flu vaccine for the particular year that we're dealing with, and ask them to order flu vaccine from us. And when the orders come in, we determine how much we can give out and then send it out to them. Have them send us in the location and times of their clinics, put that up on the website, and that's basically, in a nutshell, kind of the way it works.
Who are some of the partners that you work with in the community?
We work with some private physicians, we work with home health care agencies, we work with skilled nursing facilities, we work with school nurses sometimes also.
So you work with a wide variety of different community-based organizations that
Yeah,
do
oh,
healthcare.
definitely, yes, definitely.
And what are the implications for a pandemic? If we have a pandemic, in theory, the government will have access to a pandemic influenza vaccine that we will have to distribute. So how is the experience working in these annual flu clinics where you're immunizing 25,000 or so people a year going to help us when we have a pandemic that we have to set up similar kinds of flu clinics?
Well, I think the experience that we have had setting up these clinics has given us a number of different ways in which the material that we use can help us during pandemic flu. One of the things that we have, as you have said, great experience doing is running mass clinics where we manage the flow of many, many people in a very orderly fashion. We've gotten accustomed to working with community volunteers, student nurses, and retired nurses, which would be of great help during a pandemic. We managed to transport the vaccine and maintain the cold chain integrity with the vaccine, which is very important because you want to make sure that the vaccine that's delivered to the patient is viable vaccine, effective vaccine, and so we managed that very well. We have also developed partnerships and relationships with many other people in the community. So we have close lines of communication with skilled nursing facilities, with hospitals, hospital infection control practitioners, school nurses, as I said before. And we have developed ways of dealing with the public during crises, such as what happened in the year 2004 when we didn't have enough flu vaccine.
Right. So you're talking about the experience you've had in the past few years when there have been shortages of vaccine or production delays that led to vaccine being available later in the season than it was really needed.
Right.
So that's a challenge for any physician or any organization that's trying to immunize people. Tell me about yourself and the nurses and other healthcare professionals that you work with. You're immunizing large groups of people, vulnerable populations, seniors, disabled, people living in institutions. How do you protect yourself from some of the viruses and things that they may have? And certainly during a pandemic, some of your volunteers may say, hey, not this year. I got to protect myself and my family. So what kinds of reassurances are you giving to the people who may work with you about how they protect themselves from pandemic influenza?
Well, I think, obviously from my position as immunization coordinator, one of the most important things a person can do during a pandemic flu outbreak is to make sure that they're appropriately immunized against the other vaccine preventable diseases, because that will afford them a better immune system to fight off pandemic flu.
So those are things like pneumococcus,
pneumococcal polysaccharide vaccine for 65 and older, Tdap vaccine for any adult.
Now Tdap is tetanus, diphtheria, and pertussis.
Right, vaccine. MMR vaccine for certain populations. Those basically are the vaccines that...
And MMR again is measles,
mumps, and rubella vaccine, right. So that would be the first thing. And then I think maintaining a healthy lifestyle, eating well, exercising, getting enough rest are really important ways of protecting yourself. And then, of course, things like washing hands. Washing hands is going to be very important, and covering your cough. Even possibly during pandemic flu, the use of masks.
Good, solid advice. So thanks. We really appreciate you coming on. And now we're going to move to a slightly more focused discussion on a clinical setting where doctors and patients are dealing with high-risk populations and have to manage the protection of themselves and those populations from getting infected. Stay tuned.
Some masks are works of art, others are for fun.
Some masks protect you, others protect those around you.
Airborne droplets from your cough or sneeze can expose others to influenza.
Use tissues to cover your cough. And if a flu pandemic arrives, please cover your cough with a mask.
For more information about pandemic flu, visit pandemicflu.gov or ACPHD.org. Brought to you by the Alameda County Public Health Department.
Well, we've heard a little bit about how clinics are managing both to take care of their staff concerns and to take care of the patients that come to the clinics to visit for a variety of reasons, including respiratory illnesses. We're now joined by Dr. George Lee, the Medical Director of Asian Health Services. Thanks for joining us, Dr. Lee, who's going to give us a perspective from a clinic that deals with a population that may actually be traveling to some of the countries in which avian flu is circulating now and may, in fact, be circulating more intensely in the future. Dr. Lee, can you tell us a little bit about some of the patients that Asian Health Services sees?
Yeah, most of our patients come from China, and we have a fairly significant population coming from Vietnam, as well as Korea and Cambodia and a lot of the Southeast Asian countries.
And it just so happens that bird flu or avian influenza is circulating in some of those countries now, and it's also been found in other parts of the world as well.
Mm-hmm.
You've had a lot of experience of late with things like SARS that certainly circulated in some of these same countries, and with the amount of travel between Oakland and these countries, people going home to visit relatives and coming back and bringing relatives, you're no doubt one of the first places that people go if they start to note that they're feeling sick.
Mm-hmm.
How does that affect what your staff is feeling in terms of what they feel they may be exposed to?
Well, certainly during the SARS epidemic, there was a great deal of fear amongst our staff, such that we had to do a lot of trainings amongst the staff just to allay their fears, as well as to give them actual concrete things for them to do in order for them to decrease the risk of transmission to themselves and amongst the patients. And so I think we've been able to take some of those experiences and transport them to this experience with the avian flu and possible ways that they can protect themselves as well.
Can you give us some specifics? What kinds of things might a staff member be asking you as the medical director? What is my risk?
Yeah. Certainly we give them as much information as possible about the transmission and the types of patients who are coming in and what their clinical signs and symptoms might be. We also make sure that there are Kleenex boxes around, because something as simple as covering your cough or giving the patient who's in front of you a tissue will be helpful in decreasing transmission. What we also did was we bought the little Purell alcohol-based rubs, and we put them in each of the exam rooms as well as in all the front desk areas in order for staff to be able to wash their hands very quickly. We also increased the amount of garbage cans that were in the waiting room, as well as we helped to tighten up our triage protocols so that when patients are coming in, we could identify them right away and be able to engage a special protocol for them to come and avoid the waiting room.
So relatively simple things, but still powerful.
Yeah, absolutely. And it really gave them a sense of empowerment that they could do something in order to help with this epidemic.
And that's a very, very important point, to give people some sense of control over this situation. Now tell us a little bit about the patients that you're seeing. Do you have people coming in that are coming from Indonesia or other parts of the world where bird flu is actually circulating that are saying, hey, do I have bird flu?
Yeah, absolutely. They come in, sometimes they actually come in before their trip to see if they can get any medications just in case they contract bird flu abroad. And some of them do come back asking to be checked out as well. Most of the time, they do not fit the criteria, and so a lot of it is really just reassuring the patient that they're okay and that they don't need to do anything that's different.
Great. Now, what about birds? We know when we go through Chinatown, we see birds,
Right.
hanging in window shops, and certainly at one point these birds were alive, and they were essentially birds that are the same kinds of birds that in other parts of the world have been transmitting bird flu. Do you have any kinds of information that you're giving to patients around how they should handle themselves when they come into contact with birds?
Right, we actually do tell them to try to avoid the live birds as much as possible, and if they do come in contact, that they need to wash their hands afterwards, but we actually try to tell them to avoid it.
Well, that's great. Well, there is no evidence yet that there is any bird flu circulating in North America, and we're quite confident that if it ever got to these shores through migratory routes, we would be able to recognize it pretty quickly because birds would start to die. So there's no concern right now, as you well say, for people that come into contact with live birds, but for the sake of other diseases and other respiratory diseases, good hand washing and all the principles that we've been talking about are important. Now, is there anything that you would like to tell somebody who might be coming to your clinic who might have some concerns about what they might be exposed to in the waiting room? Any words of reassurance you'd like to offer?
Well, I think that in the beginning with the pandemic, we are in the beginning phases of surveillance, so that if anything does happen, we work with our public health department so that I think that we would know right away whether or not what the caseload might be so that we would be able to improve our notification to patients as they come in.
And you're definitely one of our critical partners, as are many of our clinics, and we expect that an astute physician is going to give us a call one day and let us know that they think they have something in their office, and that's going to trigger a real response. So we thank you for all the work that you've done and your continuing partnership. So we've just finished talking about healthcare, and we've put these shows together for a very specific purpose, to try to talk to people about the basic things that they're going to need should a pandemic occur. We've talked about work, because most of us need to work to pay our mortgages, to pay our rents, and we've talked about some strategies for protecting yourself in the workplace, and we've looked at some innovative strategies that some employers are utilizing to try to minimize the risk of spread of pandemic influenza in the workplace. We talked about food, because we all need to eat. We talked about how to stockpile. We talked about what you might want to look for when you're going to the grocery store. We've talked about restaurants, and many of us, like myself, enjoy going out to restaurants and would like to continue to do so. We talked about transportation. We know we all need to get to and fro. Not all of us can drive at all times, and we shouldn't. We can use alternative means of transportation, including bicycling, walking, and we can take public transportation. If we're going to do that, there are certain things we need to know, and it's good to know that our public transportation partners are taking very seriously the threat of pandemic flu and are taking steps to try to minimize the risk of spread in public transportation settings. We talked about schools, an important thing to be always on the lookout for. We talked about what school systems are doing in general, should schools have to close, about sick leave policies. We've talked about the strategies that school nurses are using to educate children and others in the school system about respiratory hygiene, hand washing, etiquette, and all of those things that will minimize the risk of spread in the school setting. And finally, we talked about healthcare. Many of us have to take medications, we have to go to the pharmacy, we have to go to the doctor, and certainly when a pandemic is spreading, none of that stuff is going to go away. So the advice that we heard from our experts about how to access healthcare safely, about what the staff at the healthcare setting is going to be on the lookout for, how they may offer you a mask, offer you a tissue, all of that is going to help our community minimize the risk of spread of pandemic influenza. In public health, we always hope for the best, but we prepare for the worst. And we hope that these shows have offered you an opportunity to think about some of these questions and to take some proactive steps to protect yourself. Now let's go to Dr. Bob and talk about some of the themes, the recurrent themes that have played out in these 4 shows. Bob, what do you have to say?
Thanks, Tony. The one thing that I think we absolutely need to reinforce is that influenza, be it pandemic or the annual variety, is spread by the respiratory route, and the single most important thing that each and every one of us can do is pay attention to our own personal hygiene. Cover our coughs, wash our hands frequently, and if you're sick, don't go to work because you'll give it to somebody else. Having said that, we need still to prepare on a large-scale basis. This has to do with having adequate supplies for any disaster, including a pandemic, of food, adequate water, sugar, salt, medicines. Not only the prescription medicines, we heard about stockpiling prescription medicines, but it's also a good idea to think about the over-the-counter stuff, the stuff that you use on a daily basis for your ordinary colds, because these too may well be in short supply. There's another thing that we need to consider, and that's even though we may not have an effective vaccine for a pandemic flu, the leading cause of death for average flu, your seasonal flu, is not really the virus itself, but bacterial superinfection. So for both kids and adults, it's absolutely mandatory to get flu shots and, for adults, pneumovax to protect against pneumococcal pneumonia.
Thanks, Bob. For more information about the science behind pandemic flu or avian influenza, or what governments are doing to plan, visit the Alameda County Public Health Department website or any of the other websites. One of the caveats that we need to keep in mind, and this is more for us public health folks than it is for people out there watching this show, is that we're going to try to be as diligent as possible to get as much pandemic vaccine, and that's the vaccine that'll help prevent the spread of the pandemic virus should it happen, as we can, and we're going to get it out to people as quickly as we can. But the expectation is that probably for the first 6 to 8 months of the pandemic, we won't have any vaccine, really, and certainly not enough to protect the entire population. The same goes for some of the medications, the antiviral medications that we might want to use. That's why it's so important for us to be talking to you now about those key measures that Dr. Bob and all of our great guests talked about to try to reinforce that there are some things that we all can do as individuals and as community members to try to minimize the spread of this virus. We've enjoyed making this show. We've enjoyed talking to you. We encourage you to call us with your questions, your suggestions, your ideas. Together, we can make this work. Thank you very much.